So if you're considering non-surgical options to rejuvenate your skin, you've probably heard of Sculptra and Profhilo. Both of them are common and leading treatments, but they have significant differences. I'm Dr. Owen Thomas. I'm a specialised aesthetic doctor in London, UK, and I'm here to help you understand the differences and what will be best for your skin. So first off, Sculptra. This is a powder which is made up into a liquid. You can see it's been dissolved here, and this solution is injected underneath the skin. So Sculptra has been around for many years, since the 1990s. It was given a license in 2004 in the US by the FDA for treatment of lipoatrophy in HIV patients who had significant fat loss from the medication. It's been used increasingly with aesthetics, and in 2009, it got an aesthetic license with the FDA for treatment of skin rejuvenation. And with the aesthetic license that it got in 2009, it's been increasingly used, particularly in the US, but now increasingly worldwide, for skin laxity, deep wrinkles, and general facial rejuvenation. So Profhilo is very different. It comes in a gel form, as you can see. It looks a bit like a dermal filler in a syringe, but it's not bound together. So it's got stabilized hyaluronic acid, and that's the same substance in most dermal fillers, but it's not bound together, it's stabilized together, so you have a very high concentration of the HA within the substance. It was released in 2015, made by an Italian company, and has become widespread through Europe. It's particularly popular in the UK, where I'm from. It hasn't yet got an FDA approval license as far as I'm aware, so unfortunately in the US you can't use that. There are some other alternatives, but they're not quite the same. So the aim of Profhilo is for hydration, and what the manufacturer says is bioremodeling. That means collagen production. So it is injected into the skin, it hydrates it significantly, and the hope is that it might also produce some collagen along the way. Profhilo is pretty easy to use because of its administration, and it can be used in areas where Sculptra typically is not, such as the neck and the backs of the hands, for example. So when we look at indication and dosing, Profhilo is given at 0, 1, and ideally 6 months. That gives it a slightly longer duration of action. Profhilo is injected in 5 points in the face. This is the BCAP points, and this is designed to optimally allow the product to spread through the face in the most effective way. As mentioned before, it can also be used in delicate areas like the neck and the décolletage and the backs of the hands. So Profhilo is great for immediate skin hydration and giving a quick boost, and I'll go on to that in a minute. Sculptra is a more heavy-duty treatment, and this is designed for people with more significant aging around the cheeks, the jawline, and the temples. So while Sculptra is really great for addressing aging changes in elderly patients or those who've lost a lot of weight through illness or medication, it's increasingly used by younger people who can see the benefits of the collagen increase. We know that we lose collagen about 1% per year from the age of 20, 25, and if collagen can increase significantly with the course of Sculptra, then that can only be good at an anti-aging as time goes on. The number of vials and the number of sessions with Sculptra is much more variable. We can see improvements just after one single session with one vial, but usually looking at 2, 3, or 4 vials spaced over a period of several months to get maximum benefits. When you're injecting Sculptra, it tends to be around the area from the temples over the mid to lower face. So this is a little bit more limited than some treatments, but this is one of the areas where most people significantly see facial aging. There are different ways to do it. Traditionally, it's been used with a needle technique and a higher concentration, but that led to nodule formation. So these days it's diluted with a much greater volume. I use 2 or 3 points on each side, a little bit of local anesthetic, and then the cannula slides underneath the skin, and we're just fanning the product around. So there's one just by here, and that goes up into the temple, forward into the cheekbone. Around the jawline, we can go forwards and we can cover most of the buccal area, the mid to lower cheek. And then just in front of the buccal area, another point, we can go into the nasolabial fold and across the lips and into the marionette zone. Because of the numbing injection and Sculptra has local anesthetic mixed within it, the treatment is really comfortable and most patients don't feel anything during the procedure. Profhilo, on the other hand, is injected straight into the skin, and you get a little lump where the injection goes in, and this spreads through the skin and disappears within about 24 to 48 hours. I find that Profhilo stings a little bit more than Sculptra, but it is temporary, just lasting a couple of seconds. So how does it work? Profhilo is pretty straightforward. It's made of one substance, that's hyaluronic acid, and we know that the more of this substance you have in the skin, the better the skin looks in terms of a glow and a youthful appearance. It looks plump, and this is great for fine lines and wrinkles. It's a relatively quick improvement also. We see something within a week or 2, which is very different to Sculptra. The effect of Profhilo on the underlying collagen production, however, is much more uncertain. It's thought that there might be a little bit of an improvement, but this is the same sort of improvement you might see with dermal fillers. We know that HA increases collagen slightly, but not as much as some of the other specific collagen treatments. Sculptra, however, is very different. It increases collagen production significantly, and this is because it affects the fibroblasts, the cells that produce collagen, but also other cells called macrophages, which are really important in this. We know that Sculptra and the particle size is crucial in activating the macrophages which are necessary, and there are a lot of cheaper PLLA alternatives such as from Asia, and we just don't know whether this will have the same effect as Sculptra does. So Profhilo gives you benefit with hydration occurring relatively quickly over a week or two, and this is maintained for at least a few months after the last treatment. One study showed that within 24 weeks all of the Profhilo had gone. So it's really an improvement that you're looking for over a couple of months, and it's got to be repeated a bit like Botox. Sculptra also produces hyaluronic acid, but this comes from the cells inside, and therefore there's a little bit of a time lag, but the most important thing is the collagen benefits. This starts after about 2 weeks, and it gets to maximum by about 3 to 4 months. Even after that time, the early new collagen gets transferred into another long-term collagen called collagen type 1, and the benefits from Sculptra when you get the collagen last for 2 years or more. Indeed, we think the effects are probably significantly more than 2 years, and that's just because the trials tend to stop at 2 years, so we haven't got any longer term data, but collagen within the skin that's integrated is probably going to last a lot longer. So what's the evidence behind the two treatments? So for Profhilo, there's not as much evidence, it just simply hasn't been around as long. The most important study recently was from the Journal of Clinical Dermatology, and this showed that their skin hydration with Profhilo increased by about 20% and skin elasticity increased by about 15%, which is not bad, but if you've got more advanced aging changes, this probably isn't going to be enough to see a very significant benefit. Sculptra, on the other hand, has a great deal more evidence going back several decades, and it's this body of evidence which has allowed it to get the FDA approval for multiple indications. One study from the Journal of Cosmetic and Laser Therapy showed that there was an incredible 67% increase in collagen density within the skin after 6 months. Another similar study showed that the actual thickness of the skin improved by almost 30% over a period of 3 months. And at present, we've got limited data as to the effectiveness of Profhilo with collagen, but we can see that Sculptra does produce a huge amount, probably more than most other treatments. So what about side effects and recovery? Well, both are pretty well tolerated. After Sculptra treatment, you might get some initial puffiness because you're injecting fluid underneath the skin, maybe some slight redness, and because you're using a cannula underneath the skin, it is possible that you'll get bruising more so than Profhilo. Profhilo is generally well tolerated. You might get tiny bruises at the injection site. Some people can get a little bit of swelling and itching or redness, which can persist for a day or two, but the downtime is minimal with Profhilo. There don't seem to be significant long-term issues with Profhilo because it's quite a simple product that is natural and spreads within the skin. With Sculptra, traditionally, when it was injected in a more concentrated form with needles, there was a chance you might get nodules, little lumps that can form. But with the modern dilutions, diluting it a lot more and spreading it over a larger area, these nodules seem to be much lower in frequency. About 5% of people have micronodules that you can hardly feel even on deep palpation. Around 1% or less might get a small nodule that you can feel. So to prevent nodules forming with Sculptra, there's a rule of 5s with massage. That's massaging the face where the treatment's been 5 times a day for 5 days and for 5 minutes at a time. It's not particularly evidence-based, but it's common sense and probably good practice and something that most practitioners still recommend. So which should you choose? So Sculptra is definitely one for people with more advanced changes or people who are more interested in getting a longer term benefit with collagen production in preventing the skin from aging over the longer term. The results that you see from Sculptra are more gradual, onset over about 2 to 3 months, and the maximum benefit seen even by 12 months. But the results speak for themselves, and you're looking at 2, 3 or more years benefit. Profhilo is something which is more immediate, occurring over a week or two, and it gives great hydration and it can make the skin look really healthy and glowy. So if you've got an important event, that might be something to go for. But the collagen improvement from Profhilo seems to be a lot less and is not particularly evidenced in the studies that we have. So my personal preference is using Sculptra alongside other treatments that increase collagen. You get the most bang for your buck. So you can use Sculptra with Morpheus 8, that's a radiofrequency microneedling treatment. You can use that alongside something called Jali Pro. And there are lots of other treatments that really improve collagen alongside more focal treatments like dermal fillers. So if you want to check out my video on one of those treatments for collagen, I'll see you in the next one.